This month for Parkinson's Disease Awareness Month. Really excited to talk to you all today about some of the great things that our physical therapy team does and provides here for the community. So, Elena, tell us a little bit about what you do here.
My name is Elena Dwyer, and I'm one of the physical therapists in here. A great team of physical therapists. There's two of us that practice the LSVT Big program, which is short for Lee Silverman Voice Training Program, and it focuses on the treatment for Parkinson's disease. We've had many years of practice with these programs. I mean, I can still remember our first patient, and we've had a lot of successes with it. And then recently we started with the Big for Life, which is a community follow-on exercise for the graduates of the Big program. It has to be a four-day-a-week treatment for an hour each. So she usually takes one day, and I'll take the other 3 days. Or she can have her own because she's here for 5 days.
So describe to me some of the exercises that you work on with patients.
Okay, so the main symptoms are slowness of movement and the posture where they kind of stoop over like this. They start shuffling, which makes them really prone to falling. And so the exercises are geared towards making their movements big. That's why it's called LSVT Big, because they have to move it big.
Very creative.
And exaggerated. So they feel like, they feel funny actually trying to do these movements because it's so big, you know. So like a lot of stepping with arm movements that make it big like this, you know, or like really emphasizing the movements of the feet, like the amplitude. It has to be not just the big movement, but also how, you know, you got to go like this, because the slowness itself can, you know, they think that they're moving normally, but then they're moving very small and very slow. That's why you have to make it like that, like a sudden, like you're almost scaring somebody, you know, so that they get that amplitude. And they have to internalize these movements so that they're not just doing what they're seeing, because we have to do them in front of them so that they can see it. But they have to be able to do it on their own after they internalize how big the movements are.
So you're almost kind of retraining.
Exactly, it
like
is.
The brain.
It's exactly what that is. It's a neuromuscular training. So they have to do it physically, and then as they internalize it, it's what you call calibration. So they're internally calibrating their movements, so then they know that they're doing big movements instead of just this. Big difference between just doing this than like that.
Requires a lot more focus too.
More effort too, because they're used to not moving. They do a lot more sitting. They stoop, and now they've got to actually use those muscles when they do the big posture and the big movements.
How long do people usually stay in the Big program for? Just kind of inevitably, or?
The initial program is just 4 weeks.
Okay.
4 times a week for an hour each for 4 weeks.
Okay.
And then they graduate. Sometimes if they're especially more advanced, it could take up to 6 weeks for them to calibrate.
Wow.
But typically it's 4 weeks.
Okay.
So then after that, we usually tell them come back in 3 to 6 months so that we can do another test. We'll do like a sort of like a reassessment. And if they maintain their numbers, meaning they keep doing their exercises twice a day for every day, like there's no holidays, there's no vacation. If you're sick, sure, yeah, you can stop, but you got to pick it back up, because if you don't do it every day and if you don't do it the same, it's going to come back, you know.
I mean, it sounds like you guys have a wealth of resources too. Lots of knowledge here to be able to offer to, you know, patients or, you know, loved ones, friends, family who are struggling and, you know, living with Parkinson's. I think the big thing is that we always like to say we can try to work with our patients to keep them living well if they're struggling with those challenges. So that kind of does it for us today. We just wanted to kind of share hopefully some knowledge and some tools with you all about the awareness, the disease itself. And if you have any questions or seeking for any information, where's a good place that folks can visit online maybe? Is there like a Parkinson's, a health website or anything?
This program is lsvtglobal.com.
Okay.
So if they want there's videos in there, there's teaching videos
That's
from
awesome.
doctors, there's videos of patients themselves,
Oh, wow.
speech therapy patients and PT or OT patients from before and after. I mean, some of them are really remarkable in how the change from therapy to post therapy.
Wow.
There's one specific one for speech that's like, whoa. I mean,
Wow.
it's like amazing difference.
That's amazing. That's amazing. Well, check it out, guys. And if you guys have any questions or like we said, if you know somebody who might be living with Parkinson's and you just kind of want to call and talk and see if this might be a right step for you, should they just call the main line for physical therapy and rehab
Main
here?
line or directly to us,
Okay.
540-316-2680.
2680.
Yep.
Okay, perfect. Awesome. Well, thank you so much, Elena, for joining us
welcome.
today. Thank
Thank
you
you
all.
very
Hope you got
much.
some, good takeaways from this. Take care.